50,000 vaccines are set to arrive in the valley next week. And Jacqueline tells us who's getting it first and how they're managing the transport.
Yeah, John, according to the Southern Nevada Health District, first responders and critical healthcare workers are going to get all those vaccines first. They're in the state's tier 1 and at the top of that list. They're going to be getting all of those 50,000 doses. Now, how many of those healthcare workers need it and how many want it? That's still yet to be determined. Officials are working on those estimates, but there are, keep in mind, 300,000 healthcare workers in the valley. The vaccine supply will have Moderna and Pfizer vaccines, so not all of those doses will need that ultra cold storage necessary. Health officials say they do have enough freezers throughout the valley for those doses that come in. So only when Pfizer and Moderna's vaccine gets the authorization from the FDA, then it will leave the Southern Nevada Health District and trucks will send them to hospitals and different healthcare providers. The supplies will need security at all times, even during transport from local law enforcement to Homeland Security.
Security of the vaccine is a very important part of this because, everybody wants the vaccine. And so really we have to plan accordingly that we protect the vaccine that we do have. So it's not going to be readily accessible by anybody that was seeking it.
And health officials say it's going to be up to those hospitals and those clinics to schedule the appointments for those healthcare workers and quickly, but they ask them to stagger the time that first responders do get the vaccine. Doctors say some side effects may last a day or two, like fatigue, soreness, or some flu-like symptoms. Coming up at 6, when are others next? And when more of the general public will get them, how exactly will they get them? John, back to you.